Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn an important topic in orthopedic, that is osteochondritis of head of femur. So let's dig into it. So we are going to learn about osteochondritis of head of femur. So it is also called as coxa plana, and coming to its definition, it's an idiopathic spontaneous osteonecrosis of head of femur due to blockage of venous. Remember, it's a venous, not arterial. Venous outflow which leads to thickened distended veins, and it leads to arterial compression. And once compression happens, ischemia should enter the game, right? Ischemia will happen, and it enters to the final stage, osteonecrosis. Then coming to its statistics, its incidence is 1 in 10,000 and slightly male in preponderance. Then coming to the causes, most commonly idiopathic, and we observe most common associated with protein C and S deficiency. Then coming to bilateral in prevalence, it is of 10 to 12%. Then clinical features, referred pain at groin, hip and knee, inability to squat or sit crossed legs, and limping gait or antalgic gait. Remember, antalgic gait is nothing but when you get injury to your leg, you will do jumping japan. That gait is called as antalgic gait. So coming to investigation, most of the time in orthopedics it will be MRI. Investigation of choice will be MRI. Then coming to X-ray of hip joint, you are going to see a Tritho1 sign. Coming to this Tritho1 sign, if you want to know more detailedly, I have made a separate video on Tritho1 sign. It is related to hip line passing through it. You go and see that videos for clearance. Then management, we'll do stepwise management. Initial days, we'll give non-weight bearing things, and we'll ask them to bed rest. Then we'll use skin traction. Then after some months, we are going to offer him with a total hip replacement, where mainly we aim for supervised containment of head of femur in acetabulum. So let's quickly revise. Today we studied about osteochondritis of head of femur. It is also called as coxa plana, idiopathic spontaneous osteonecrosis of head of femur due to blockage of venous outflow, which leads to thick and distended veins. Arterial compression will happen, which leads to ischemia. Then comes to final stage, osteonecrosis. Then coming to statistics, 1 in 10,000 and male preponderance. It's a idiopathic but most commonly associated with protein C and S deficiency. Bilateral prevalence 10 to 12%. Then clinical features are referred pain, groin, hip and knee. Then inability to squat or sit cross-legged, limping gait or antalgic gait. Then investigation choice will be MRI. Then in X-ray you are going to see Tritho1 sign, and management will be done in 2 phases. Initially we will ask him to maintain non-weight bearing or bed rest. Then skin traction will be given. Then we'll give total hip replacement, where we try to maintain containment of head of femur within an acetabulum. Yeah, I think.